Hey guys, this is Matt. I just wanted to do another weekly spinal cord injury video for you, just to kind of bring you along my journey. Again, some things I'll read, but very shortly. I won't do a lot of reading off the script, but there are certain things that I want to point out, so I'll just go ahead and do that. Let's see, something interesting that I realized this week, and again, I'm 2 years out. I'm about 25 months out from my lumbar fusion surgery. But this one hit me. It was like profound this week. It actually just hit me hard. It's all on you. There's nobody coming to save you. It's your body. And you're the only one that can make, the proper decision for you. And the really profound thing is not just that, but it's what I wanted to explain is that surgeons, I've had 14 surgeries, so I've been through a couple of surgeons. Surgeons, and especially with back surgeries, they are, skilled in their profession, in their career. It's their job to explain to you up front, what the dynamics are, what the risks are, etc. And then after they cut on you, they're done. Especially with spinal cord injuries and nerve-related issues, because this is a huge surgery. And once they're done cutting, they really can't go back and do much else, especially if you've had a large surgery like I've had. I've had, 4 lumbar fusion. That's a big surgery. It's like one of 3 that you can have that's really big. So once they cut on you, they're not going to reopen you. And if they do reopen you, you're going to have to go through, as I'm finding out, a lot of steps. You have to have an epidural injections. You have to go through all this stuff for surgeons to even take another look at a corrective surgery. And your odds go way down, like 50%, flip a coin, might get better, might get worse. So yeah, again, I just want to stress that it's just so important to do your due diligence and research and think and take your time and check out the doctor and ask the questions, because this is a very, very serious thing. So anyway, that was my profound thing that I thought, damn, I wish I would have known that, that once they cut on you, there's not much they can do. And you'll hear this in my story today with my experience of going through surgery and all that. So anyway, and by the way, doctors, nurses, PAs, whatever, they all hate ChatGPT. They hate it. But it's your best tool. Trust me, it's your best tool. I've had it read my MRIs. It's like 5 doctors in one reading my MRI. It's wonderful. And it gives you a nice pragmatic view and a pragmatic point of view to your questions. And it's excellent with pros and cons. So definitely use ChatGPT. But when you go to the doctor, be careful, because their ego gets hurt really bad, really quick. So anyway, that was my profound thought for the week. Okay, let's see, questions and answers. I'm just going to read this because it's kind of the setup for the video. A year ago, my goal was simply to survive the surgery and get back to normal. Then my goal became finding out why things weren't getting better. Now I'm facing something even harder, which is learning how to build a meaningful life with uncertainty. And I mean uncertainty by the minute, because I don't know when spasms are going to happen. I don't know when I'm going to have severe pain for that, for that day, or when in that day. So that's kind of what I'm going through right now. That's where I'm at 25 months post-surgery. So what I did was I just asked GPT to be like a interviewer for me. So it wrote questions down that I'll just read and answer the best I can. So let's see. Before the surgery, what were you feeling the morning of surgery? Just fearing like I wanted to get over with. I just wanted to get it done. I remember the day before the surgery, and I was scared shitless. I mean, I was really, really scared. I just sat in my chair and I prayed, and I was just really scared. But I did get comfort after I prayed. So, but yeah, it was serious. It was a serious, like, oh yeah, this is a serious deal. So that's what I was thinking the day before surgery. Again, my thoughts really prior to that was just, I'm losing my job. I don't know what the hell to do. I need this surgery. Let's get it done. And by the way, I did win a wrongful termination case, which is great. I just won it last week for the job that I lost prior to surgery. So Anyway, were you scared? Yeah, I was scared. Just wanted to get it over with. What were your biggest hopes going into surgery? You know, I was so focused on just getting it done. You know, I was just in go mode, and that's just where I was. So, waking up. What is your first thing you remember after waking up? Okay, the first thing that I remember, which is very interesting, was I woke up, and obviously you're in pain. You know, I get it. I'm used to bone pain and hardware being put in. They dope you up, so it's not like, you know, you're majorly, you know, in pain. So I remember about 4 hours after surgery, and I woke up, my doctor's sitting there at the end of the bed, and I said, "Thank you so much for doing this. I really appreciate it, you know, and doing it so fast and everything." And he said, "Don't thank me yet." And he said, "Just don't thank me yet." That's all he said. And then he walked out of the room. That tells my whole story, basically. The doctor didn't do his due diligence, and he should have done that. I have never seen the doctor, the surgeon that cut on me. I've never seen him after that 4 hours after surgery. He never saw me. I only saw his PA. Not that he could have done anything anyway, like I said. So that was my 4 hours after surgery. I didn't really, you know, think about it then. I was like, okay, thanks, bye, you know, whatever. So that's what happened there. What was your pain level when you first woke up? It was, like I said, they keep you comfortable. What they do is they give you baclofen or Robaxin, muscle relaxers, heavy muscle relaxers and pain pills, Oxycontin in my case. So, hey, I was feeling good, man. I got pudding. I was happy. You know, it's not a big deal, actually. I mean, it's a big deal, but it is a big deal. You're waking up with, you know, a tube in your back, and it's a big deal. But thank God they can make you comfortable. So that's good. So I wouldn't worry too much about that necessarily. Did you immediately notice anything felt different? Yeah, my back was like hurting. Were you relieved the surgery was over? Yes, I was relieved. The hospital, what was the hospital experience like overall? It was pretty good. I went to Fresno Regional Medical Center in Fresno. I don't know if I can say that on YouTube, but that's where I went, and it was good. It was a good hospital, and I went to a very nice rehab too as well. Afterwards for, I think, 19 days I was in rehab. Did you immediately notice anything felt different? Yeah, just, you know, you got hardware in your back. It feels different. Were you relieved? Yeah, okay. Sorry. When did they first get you out of bed? I think it was like the next day, because it was like evening when the surgery was done. So they got me out of bed the next day, and it was serious. I mean, you know, you can definitely tell there's hardware in your back, and there's something in your back, and you can't bend over, and it really creates a rigidness to your back, because obviously they've fused levels of your vertebrae. So, you know, but it wasn't the weirdest, hardest thing in the world. I mean, you can walk afterwards. Your back is stable because the hardware's in there. So, I mean, it's not too bad. What was the hardest part of being in the hospital? You know, it really wasn't hard. I mean, to be honest with you, it was pretty decent. They treated me really nice. They took good care of me, so it was fine. The pain. How was the pain different from the pain you felt before surgery? It wasn't, you know what? It was non-existent, and the spasms were gone. And my leg twitching and all the little spasms I had before surgery were gone. So that's why I was like so elated, and I thanked him. I was like, great, thank you so much. And like the next, after I got out of rehab, about 3 or 4 weeks later, I actually hobbled into his office and bought the office donuts. And I was like, thank you so much. Because like for the first month or two, I was okay. I thought, okay, this is normal, you know, getting back to normal. And I didn't have a lot of spasms. And I was just kind of adjusting. So that's what it was for me. What hurt the most during that first week? Just moving. Basically, you're just laying on your side. You're laying on your, you know, back, and you're just moving around. And I ate a lot of candy. Took a lot of drugs. You know, I mean, like I said, they make you comfortable. It's not the worst thing in the world. Was the pain better or worse than you expected? Say it's about normal, you know. What surprised you? What surprised me the most about recovery was how serious it was. It was, you know, after 19 days, I didn't know I was going to stay in there 19 days. They didn't tell me much of anything, really. I didn't know too much of anything, but they sent me to a rehab for 19 days. They helped me a lot. It was a great rehab. Taught me a lot about the bathroom issues and all that stuff, which I'll go into in a later video, but all the tools that you need, oh my God, it's like a toolbox from hell. Yeah, it's a life changer for sure. How you put on your shoes, etc. Like everything changes. Was it easier than I expected? No, it was probably harder. What was much harder than expected? Just realizing how different life's going to be. It's different. Going home, what was it like leaving the hospital? It was challenging because from that point to this point, I can't put my knees above my hips. Because if my knees go above my hips, I have major back spasms. It's almost like, for me, it's like the surgeon cranked down my spinal cord from my neck all the way down to my butt. And it's like he just cranked it up so that I can't really bend over, or have my knees above my hips. Because if I do, my spinal cord says, no, don't do that. It's too stretchy. It's too stretchy for my spinal cord. So I had to get my van, a very good trick. This is a very good trick for anybody that's doing this. I saw it on YouTube. Somebody else told me about it. And put a trash bag on your seat when you come back from surgery. It's a wonderful hack. Because if you put just a regular trash bag on your seat, it makes it very slippery. So you can pivot really nicely. And I have a van, which is great. So I had a van and a Camaro, so I was lucky. But just to get in the van to go home, that trash bag worked awesome. So do that for sure. That's a great hack. Let's see, if you go back and tell yourself, what challenges did you face once you were on your own? A lot. I had a friend help me, which was great, but that friend wasn't there all the time, and it was pretty much just me and the next door neighbor across the street. She had knee surgery and I had back surgery, so we kind of helped each other, but it was pretty much me going through the whole thing. If you could go back and tell yourself one thing before surgery, what would it be? Slow the hell down. Slow down, back up, ask questions, do your due diligence. What advice would you give someone who is about to have spine surgery? Back up, do your due diligence, take your time, talk to other people, investigate the surgeon, etc., etc. Talk to ChatGPT. That's been just a huge help to me. I use it as a dietitian, I use it as a counselor, I use it as a coach, I use it for everything. And knowing that it's obviously not human, but it does give you a very pragmatic outside view of what's going on. So I totally recommend it. What would you do differently if you had to go through it again? Stop. Take my time. That's the whole reason for this whole video series for you. Let's see. At the end of the first week, I honestly believed I was on my way to getting my life back. I had no idea what the months ahead would bring. Had no idea. That's what I'll talk about in the next episode. So there you go. Oh. Yeah. I think that's it. So there you go. That's the end of the video. Have a great week. And if you have any questions, whatever, email me, text me, call me. I don't care. I'm here to help. That's why I'm doing this. And I also want to end this video by saying, I am not doing this to say, oh, poor me. I am not. I am fortunate. I am one of the most fortunate people on the earth. I mean, I'm serious when I say that. There are other people with spasms that you wouldn't believe on YouTube. Just search them. Search spasms, leg spasms, failed back surgery, whatever. You'll find plenty of people with so much worse problems than I have. And I'm able to walk, which is wonderful. I'll take the pain and be able to walk than to be paralyzed from the neck down. I mean, come on, man, it's always worse. Somebody always has it worse. So I am very blessed and I have a nice life. One of the things that really, one of my learnings is that, and the silver lining, I should say, is that I'm not in the rat race anymore. I don't have to worry. I don't have to worry about money. I don't care. I'm on disability and I've got a little side business. I don't care. They cap your income anyway, so it doesn't really matter. So my financial worries are pretty much over. I don't care because I don't care about stuff. I've had a great life. I've had plenty of toys. No problem. So for me, I'm really happy. I get to do my art. I get to, have the social life now. It was very lonely in my other career. I was a general manager and everybody was trying to stab me in the back. And it was awful. I was just a lonely person in an office that couldn't trust a soul. So I am just so grateful, and I feel freed that I'm out of the friggin' rat race and the slave to the grind. So many of us are. And please know that, man, when you have life-changing issues like this, I've been through a couple, homelessness, major surgeries, etc. You know what the real value of life is and how short it is. So yeah, just be happy and enjoy every moment. That's what I'm doing, man. So thank you. Bye.